necessary action.
Jeremy Corbyn.
Thank you, Mr. Speaker. Indeed, it is almost a year since the Grenfell tragedy, and sadly, justice has not yet been done. Many of those families have still not been rehoused, and many are still living in tower blocks where they're worried around the country of the safety of the cladding. More needs to be done more quickly. I agree with what the Prime Minister said about the anniversary of the Manchester bomb. We were there at the service yesterday, and I pay tribute to the people of Manchester for the fantastic event they held last night in Albert Square, which brought all communities across Manchester together. That's the answer to terrorism. That's the answer to threats. Bring people together. Mr. Speaker, in 2010, £4 billion of NHS services were outsourced to private companies. How much is it today?
Well, can I first of all say to the right honourable gentleman that I echo his comments. The terrorists who attacked in Manchester, but also, sadly, we saw a number of other terrorist attacks in this country last year. They were trying to divide us. I think the response of all communities, be it here in London or in Manchester, has shown that we will not be divided by the terrorists, we will not let the terrorists win, and we will defeat them. Can I say to the right honourable gentleman that he asks about the outsourcing of services within the National Health Service. Of course, what we do know is that spend on the independent sector nearly doubled in the last 4 years of a Labour government.
Mr. Speaker, my question was about the amount spent now. NHS budgets have increased by just 1% per year under this government, but it's jackpot time for the privateers. Their share is up by 100% to over £9 billion per year. And we learnt that Surrey NHS has just paid Virgin Healthcare £1.5 million, not for any service they delivered, but because their bid wasn't chosen. £1.5 million wasted on Virgin Healthcare that should have been spent on healthcare itself. Is the Prime Minister concerned that this week the National Audit Office said NHS England's handling of private contractors had, and I quote, put patients at risk of serious harm?
The right honourable gentleman that on the National Audit Office report, what they said was no actual harm has been identified. It is also the case that in relation to the particular contracts they were talking about, the savings that have been made have all been reinvested in frontline NHS patient care and has helped to fund the equivalent of an extra 30,000 operations. But he talks about the percentage of money that has been spent on the private sector. I have to say, last year the proportion of spend in the NHS in England outsourced to private sector did not go up at all. There was somewhere where it went up 0.8%. Ah, yes, Wales.
Mr. Speaker, the National Audit Office criticised NHS England's Capita contract, saying, and I quote, it had put patients at risk of serious harm. Thousands of women dropped from the national cervical cancer screening programmes. Another element of the contract handed over to Capita was for GP services, which resulted in 2/3 of GP practices receiving incorrect medical records. 500,000 new patient letters left unsent. Isn't this the inevitable consequence of this government tearing up the founding principles of the NHS and putting private profit before public service?
Can I say to the right honourable gentleman, at every general election since the NHS was formed, the Labour Party has scaremongered about the Conservative approach to the NHS. They have made, at every general election, they've made claims about privatisation, they've made claims about funding cuts. And what has every elected Conservative government done? We have protected the NHS. We have protected the NHS. We have improved the NHS services. We have put more funding into the NHS. And we have ensured that we remain true to the founding principle of the NHS, that it is free at the point of delivery.
From the party that opposed the NHS in the first place, that is a bit rich. Mr. Speaker.
Order. Far too much noise on both sides of the House. I've got plenty of time, and I'm sure the principals have as well, and we will get through the questions, but preferably in an atmosphere of calm. Jeremy Corbyn.
Mr. Speaker, the Royal College of GPs says, and I quote, "The long list of failures made by Capita have been incredibly frustrating for GPs and our teams. We are still dealing with the fallout. It's public servants bearing the brunt of private failure." Mr. Speaker, GPs are leaving the profession in despair. 4,000 have retired early in the past 5 years. That's 1 in 10. In 2015, the Health Secretary said he would hire another 5,000 GPs.
Yeah, where are they?
How many more GPs are there than there were in 2015?
Well, can I say to the right honourable gentleman, we now have over 14,900 more doctors in our NHS than in 2010. And we are indeed committed to delivering 5,000 more GPs, and we've increased the number of training for GPs. But can I also say to the right honourable gentleman, he talks about this issue of the private sector being used in the National Health Service. Well, he might actually ask the Shadow Health Secretary what his view is on this, because the Shadow Health Secretary has said we're still going to buy from the private sector where we haven't got capacity in the NHS. If Shadow Health Secretary is committed to it.
That's always happened.
Mr. Speaker, the Shadow Health Secretary has a very good understanding of the needs of patients and would always put them first. And he will not be the one who's putting the private sector first. Mr. Speaker, the reality is there are 1,000 fewer GPs and the number is falling. No wonder that more and more people are writing to me every week saying how difficult it is to get a GP appointment. GPs are the bedrock of the NHS. We need more of them. Mr. Speaker, I had a letter this week from Anne. Yes, Anne, she is somebody who is retired and until recently had been caring for her mother at home. And she wrote, "The NHS pay a private nursing home for mum's care. Day after day we experience a catalogue of disasters. I can't leave my mum knowing that her needs aren't catered for. So I spend hours at the nursing home. What action is the government taking to deal with the substandard care providers give in the private care sector, which is so upsetting for so many people?"
The right honourable gentleman, and to Anne, that I fully understand that people want to ensure and want to have the confidence and the reassurance of knowing that the care that their loved ones is receiving is of a good quality. That is why it is this government, that's put into place the various steps to ensure that we are looking into the quality of care that is provided in those sectors. But he talks about the Shadow Health Secretary recognising the needs of patients. I think he was saying he recognised the needs of patients, and that's why the private sector would be used in some cases. But can I just also say to him that the former health minister, now the Mayor for Manchester, said the private sector puts its capacity into the NHS for the benefit of NHS patients, which I think most people in this country would celebrate.
Jeremy Corbyn.
The Shadow Health Secretary is dedicated to the NHS, not to handing it over to private contractors. That's the difference. Mr. Speaker, the Care Quality Commission said last year there is too much poor care. A fifth of care providers require improvement. Year after year, private sector care providers are letting down our elderly. This year, Mr. Speaker, is the 70th birthday of the National Health Service. I pay tribute to all its staff over all of those 70 years. But the NHS reaches this milestone with the worst A&E waits on record, the worst delays for cancer referrals on record, falling numbers of GPs, falling numbers of nurses, and the longest funding squeeze in its history. While this government opens the door to even more profiteering, why doesn't the Prime Minister act now to end the siphoning off of billions of pounds from patient care and give it to the NHS the funding that it needs?
Can I say to the right honourable gentleman, we do indeed pay tribute to all those who have worked in the National Health Service over its 70 years and who work there today. And we want to see a bright future for the NHS, which is why we will be coming forward with a long-term plan for the National Health Service. And what we see today is a National Health Service with more funding going into it, but crucially with more people being treated, more operations being undertaken. There are people alive today who have suffered from cancer who would not have been alive just 8 years ago because our cancer outcomes have improved. That's the reality of our National Health Service. But what we also see is that this government can only put money into the National Health Service because we have a balanced approach to our economy. What did we learn this week that the Labour Party and the Shadow Chancellor want to do? They want to overthrow capitalism. What would that mean? It would mean families paying higher taxes. Oh, well, it's supported on parts of the Labour Party. Now we know where the Labour Party really stand on this issue. But I say to the Shadow Chancellor and others, what would this mean? It would be families paying higher taxes, more debt for our children in future, fewer people in jobs, and less money for our schools and hospitals. A Labour Party that would bankrupt our economy would do unlasting damage to our National Health Service.
Thank you very much, Mr. Speaker. The government has stated its ambition for the UK to have 10% of the worldwide space industry by the year 2030. Central to achieving this is establishing our own launch capabilities within the UK through UK spaceports. Cornwall is keen and ready to play a significant part in this. So can my right honourable friend confirm that the government is committed to the establishment of UK spaceports, and will she ensure the right people get together to deliver this in Cornwall as soon as possible?
Well, can I say to my honourable friend that he's putting a good bid and is a good champion for Cornwall in this particular issue. He's absolutely right. Our industrial strategy does identify the role of new markets like space launch in driving growth across the United Kingdom, and that's why we're delivering a programme to ensure that small satellite companies can offer small satellite launch and suborbital spaceflight from UK spaceports. In relation to the specific issue on Newquay and Cornwall, there's a strong enthusiasm for this new opportunity shown by Newquay Airport and other locations around the UK. And of course, that's why in March the government brought forward the Space Industry Act to support them, and we've made £50 million available to enable those small satellite launch and suborbital flight from UK spaceports. And the Space Agency is considering funding to help kickstart promising projects and will be making announcements shortly.
Ian Blackford.
Thank you, Mr. Speaker. Can I associate myself with the remarks of the Prime Minister, both on Manchester and, of course, on Grenfell? Mr. Speaker, the Windrush scandal has taught us that the UK government's hostile environment policy has targeted those who legally live here. Young people who have grown up in the UK